So let us now discuss the next classification, that is the ulcer protective and healing drugs and the antacids, right guys? So in the first point we have that these protective and healing drugs, they are used to treat the peptic esophageal ulceration, right? And the GERD, that is the gastroesophageal reflux disease. I did talk about all the three in the previous video, so you can check it out, okay? Now, so guys, the ulceration that you can see here is caused by many factors. So one of the factors I discussed in the earlier video was that if you take excess amount of NSAIDs, right? NSAIDs cause a decrease in the prostaglandins, and definitely they will cause the ulceration in the stomach lining. So one of the reason can be increased amount of NSAIDs, right? Then there can be the food that contain some drugs, food containing drugs, right? And the ulcer can also be caused due to the infection of the Helicobacter pylorus. That's the bacteria. So infection of H pylorus, right? So to treat these ulcers, we use the ulcer protective and healing drugs. An example was sucralfate, I discussed earlier, right? So let us now leave the mechanism. We'll discuss later on. So let us jump onto the adverse effect. So first we have is the constipation. So guys, constipation means the patient is having difficulty in passing the stools because the stools are hard and they are dry. So the stools become hard and dry. Okay, so next we have is the abdominal discomfort. That means there can be pain in the abdomen, swelling in the abdomen, right? And sometimes what happens that you would also find presence of blood in the stool. So blood presence in stool, that is the abdominal discomfort, right? So let us now jump to the next classification, that is the antacids, right? So the first point we have that this substances neutralizes the gastric acid and increase the pH level, right? So we'll discuss this also. It inhibits the pepsin formation. This is also very important point, okay? Right. So let's jump to the adverse effect. So in the first we have is the esophageal reflux, that is the gastric acid comes back to the esophagus part, okay? And once the gastric acid is jumping up to the esophageal part, it will cause irritation in the esophagus, right? And it will cause pain in the chest region. That has to be like there is a heart burn, but the heart doesn't burn actually, right? So this is all about the introduction and the adverse effect, right? So now we'll jump onto the mechanism of the actions, okay? So the first we have is the ulcer protective and healing drugs. So guys, for example, this is we have the esophageal tract, okay, like this, and then we have is the stomach, like this. And for example, we have an ulcer here, this part, this is the ulcer, okay? That is the break in the tissue surface or the mucosal lining. So now what we do, we take the ulcer protective drugs like sucralfate orally. So the drugs is coming from the esophagus part to the stomach area, right? Once this drug comes into contact with the acidic medium of the stomach, so what happens? A reaction occurs. That is, the drugs, the protective and ulcer drugs, they react with the gastric acid HCl to form a paste. Very simple, right? And what happens that this paste is formed above the ulcer. So now this paste is basically acting as a protective barrier over the ulcer, and whatever the excess amount of HCl and the pepsin is causing the ulcer will not affect this particular site. So you would see that this particular area has first of all the HCl above, okay? Then we have is the protective barrier. This is the protective barrier protecting the mucosal lining, and then we have is the ulcer here. This is how we protect them. Okay, so now the ulcer has been protected. So you can see that the ulcer protective and healing drugs, they are cytoprotective in nature, okay, and they prevent the mucosal injury and the inflammation and cause healing of the ulcers. This drug is basically very important. Why? Because we know we have the mucosal lining in the stomach, okay, and then we have is the HCl which tries to erode them, okay. So once there is the erosion of the mucus, there would be the ulceration also, and also because of these remaining factors, right? So what we do, we give the protective barrier drugs, that is the ulcer protective and healing drugs. They cause a barrier and they stop the ulceration. Now the ulceration can also increase if there is continuous action of the increased amount of HCl and the pepsin, right? That is why to counter this we use the drugs, that is the protective and healing drugs, okay? Next we have is the antacids. That means the drugs which oppose the increased amount of acid, right? So I did talk in the earlier videos that we have an enzyme called is the pepsinogen, okay, and this is converted into pepsin in presence of the HCl, that is acidic medium, and this is basically a pepsin degrades the proteins, right? So guys, I did talk about the cells in my previous lectures, about that we have the chief cell, mucous cell, and the parietal cells, everything. So I want you to answer the question that this pepsinogen enzyme is secreted by which type of cells. So if you know the answer, comment down below, okay? This is the pepsinogen. So what happens that these antacids basically they increase the pH level, right? So I can say that what happens, the normal gastric acid pH is about 1 to 3, number 1 point, okay? Now what happens, this pepsin formation occurs at about 1.5 to 2.5 pH, right? This reaction occurs at 1.5 to 2.5 pH. Now I give an antacid, and this antacid they basically raise the pH level, because we know that if this is a pH scale, right? So we have the 7 here, 1 and 14. So this becomes the acidic, this becomes the basic, that is the alkaline. So if the antacids are given, that definitely what will happen, the pH will increase towards the basic part, okay? And this antacids may increase the pH up to about 4.0 pH level. So when the antacids are increasing the pH level, definitely the formation will not occur, and that is why we have written that the antacids they inhibit the pepsin formation, right? Okay, next point we'll talk about the mechanisms. So guys, in the mechanism what I've written is that the antacids here, so it is taken in the body, it neutralizes the excess amount of acid to form salt and water. Guys, we did talk about in the junior classes that acid plus base gives us salt and water, okay? So I did talk that in antacids we have the sodium bicarbonate, which is an NaHCO3, okay? Now this NaHCO3 combines with the HCl. So here NaHCO3, let's suppose we take orally, so these are the solids, and then we have is the gastric HCl in the aqueous medium, right? So this will form a simple reaction, that is NaCl, which is a salt, and then we have is the CO2 and H2O, right? This is the reaction. That is how the antacids they nutrify the amount of HCl here, that is the excess HCl, okay? And because of this there is a decrease in the gastric acidity, right? So that's all about the mechanism. So now let's move on to the next, that is the anti-H pylorus. Next we have is the anti-H pylorus, right guys? So the bacteria which is the Helicobacter, this is a spiral shaped gram negative bacteria, right? And they are present between the mucosal layer. So what are the causes that they can do? The first is that they cause the ulceration, as I told you, okay, right? And the next they cause is the gastric adenocarcinoma, that is the cancer, and specifically the cancer of the glands that lines the organ, and in this case the organ is stomach, that is the gastric adenocarcinoma. So let us now try to understand how this bacteria causes ulceration, right guys? So let us say again that we have the stomach here, right? So now what happened, as the bacteria they are present between the mucosal layer, right? So they cause the ulceration by urease activity. So let's write it down here. We have the urease activity. That means in urease activity there is the hydrolysis of urea, there is the hydrolysis of urea into ammonia and CO2. Now this ammonia guys, this tries to make the environment a neutral environment. For example, this activity is happening at this particular area, so this surrounding area becomes neutral, okay, and neutral environment, and that causes the survival and growth of the Helicobacter bacteria, survival and growth of the bacteria, okay? So now they are surviving here and they have caused the ulcer here, okay? So how can we treat them, how can we kill them? That is our main focus. So we give the anti-H pylorus drugs, right? So the mechanism here says that we have the bacteria, and the bacteria has this cell wall, okay, that is a peptidoglycan. So guys, the peptidoglycan basically have two strands of glycan, that is this becomes the number 1 strand glycan, okay, this becomes the number 2 glycan strand, okay, and these both glycan strand they are bonded with each other because of the peptide crosslinks. So this you can see here is the peptide crosslink, okay? So what happens here is that one enzyme cause this crosslink action. How? The enzyme, let's suppose this becomes the, I would write it here actually, let's suppose this is the transpeptidase enzyme, transpeptidase enzyme. Now this enzyme helps in the crosslinks of this peptide. Okay, this is how the crosslinks are happening between the peptide chains of the both glycan linear strands, right? So now what happens, we give the anti-H pylorus drug, okay, and these drugs, they bind with this transpeptidase enzyme. So once they are binding with this transpeptidase enzyme, so here you won't see that any kind of crosslinks are happening because the transpeptidase activity is inhibited. So here that there is no bond formation between these peptide chains because the activity is inhibited, right? And once the activity is inhibited, we will see that this is the cell wall destruction, because you can see a gap here, this becomes a destruction, and here we see that this is a continuous formation, so we write here is the cell wall synthesis. So we gave this anti-H pylorus drug here, it binds with the enzymes and it inhibits the action of the transpeptidase, because of which there is a cell wall destruction. Okay, cell wall destruction caused the exposure of the bacterial cell wall, right? So we can say that we gave the anti-H pylorus drug. Okay, now it inhibited the bacterial wall synthesis here, as you can see, and that causes the destruction of the cell wall here, and cell lysis is occurring because the whole of the inner content is exposed to the outermost surrounding, and because of which the bacteria gets killed. Okay, so that is all about the mechanisms. So I hope I have completed all the terms and all the topics here. So this is the introduction has been completed and all the classification has been done. So I haven't left any of the part. Yes, and H pylorus and the obstruction, yeah, everything is done. Guys, I hope you have enjoyed the video. So do like, share, subscribe and comment down below the topics you want me to make a video on. That's all for today. Thank you and have a nice day.